Vanessa, can you let me know when to start?
Yep. So thank you, everyone, again, for joining us on the Support Employment in Connecticut. Today, we will have Ellen and Kathy presenting this webinar with us, and Mark will be facilitating our webinar today. If you can please go to the next slide. And just some housekeeping information. Participant microphones are muted right now, but we might get to a point in the webinar where we are able to unmute your microphones so that we can have you speak up or elaborate on your questions. But for right now, if you do have any questions about the topic or if you have any technical issues, please let us know in the chat. This session is being recorded and it will be on our website tomorrow so that you can check out the recording, or if you know somebody who wanted to attend and wasn't able to, they can watch the recording on our website. We will also be providing CEUs for today's session. You will be able to request your CEUs after the second session. You do have to attend both in order to get CEUs. If you're unable to attend both, we will get you a certificate of completion for one or the other. And if you have any questions after today's session, you can always email us at newengland@mhttcnetwork.org. I will put that email address in the chat, but you can always find that address on our website as well, which is also in the chat. Next slide. Our team is composed of the Yale Program for Recovery and Community Health in partnership with C4 Innovations, Harvard University Department of Psychiatry, and the Center for Educational Improvement. The New England MHTTC, our mission is to use evidence-based means to disseminate evidence-based practices across the New England region. Our area of focus is recovery-oriented practices, including recovery support services within the context of recovery-oriented systems of care. Ensuring inclusion, and to ensure the responsiveness of our work, we will actively develop and maintain a network of stakeholders from all 6 states of New England to guide the activities of the MHTTC. And with that, I will pass it off to Mark to introduce Ellen and Kathleen. Thank you.
So hi, everybody. I'm very happy to be here today. I'm Mark Costa. I'm a psychiatrist and associate research scientist at the Program for Recovery and Community Health. I'd like to introduce you today to our panelists. We have Ellen. Ellen has over 35 years experience in social services, where her main focus has been employment services, working in both private and nonprofit sectors. She currently works as the employment system manager for Connecticut's Department of Mental Health and Addiction and the Bureau of Rehabilitation Services. Ellen is a licensed clinician, social worker with a master's degree in social work and a master's degree in human services administration with a special concentration in vocational rehabilitation. She has developed numerous employment programs for adolescents and adults with multiple disabilities and abilities. And Kathy Marchione works for the Aging and Disability Services. She is the Bureau Chief for the Connecticut Bureau of Rehabilitation Services. She has been a vocational rehabilitation counselor, supervisor, regional director, and is now a bureau chief overseeing field operations and policy. She presently serves on the Connecticut Autism Advisory Council. She holds a bachelor's in psychology and master's degree in rehabilitation counseling from the State University of New York at Albany. Thank you so much, Ellen and Kathy.
Thank you, Mark. Good afternoon, everyone. So glad to be here. I hope that you all do have questions and we do have conversation throughout the presentation today. It helps me think of really what you are looking to hear about. But I'm just going to start with giving you an overview. Our employment services at DMHAS, the Department of Mental Health and Addiction Services, our goal is really to integrate employment into our recovery-oriented service system. And what that really means is that we are for people to have meaningful employment, as it has shown, proven to me at least, that this really has helped folks recover from symptoms and addiction disorders as an integral part of their life. And for several people, employment really has facilitated quality improvements for their life. So in March 2011, the commissioner signed a policy for us at DMHAS that employment and education cannot be separated from our treatment system. And it really needs to be a part of our planning, our design, our funding, our monitoring, and our staffing. We currently fund approximately 33 agencies statewide to provide employment services and 5 mobile employment services for individuals with substance use. And I'll get into a little bit of the difference as we move along. So we follow the individual placement and support model, the IPS model in Connecticut. We were one of the first states in the country to follow this model back in 2001. We work very closely with our partners at what is now WestStat's International Learning Collaborative. You may know from several years ago, the Dartmouth's Johnson & Johnson initiative, which is now under WestStat. The Learning Collaborative helps myself and all our employment providers across the country to collaborate with 24 other states and regions and 6 countries, and to really benefit from what are the best practices, what has worked. We spend time with each other every month talking about things, what has worked, what has not worked, sharing resources, so on and so forth. So we continue to work closely with WestStat, which is a SAMHSA endorsed evidence-based supported employment practice. Here's a little bit just more information about specifics around the WestStat International Learning Collaborative. This is something that you can, if your state is not involved in, look into. But again, we benefit from all of our colleagues across the country, as well as other regions and other countries. So in our DMHAS world, our IPS employment providers are embedded with our clinical teams. They work closely together. They're often utilizing the same offices, and we work very closely with the Bureau of Rehab Services. There's 5 mobile employment services, as I mentioned before, which are different services, and I'll get into that a little bit later. So just to review the IPS principles, this is kind of our roadmap as to what's important, what we are paying attention to. So we have the first criteria being 0 exclusion, which basically means that services are open to anyone. They're not restricted. We're not talking about folks being well or not well enough to engage in employment services. So 0 exclusion is a very important thing. I will probably bring it up more than once in this presentation. We focus on competitive employment. We do not focus on volunteer, transitional employment. Not that those models are not valuable. That is not our focus for our employment specialists. The expectation is rapid job search. So if I sit down with Kathy, the expectation is that we are going to start looking at jobs immediately. We have criteria in the first 30 days that we're out in front of an employer with the person or on behalf of the person. I just want to say that rapid job search does not mean rapid job placement. Targeted job development is really around the person's preferences. That why are we looking at, particular industries? Again, the preferences of the person is what guides us. We provide individualized long-term supports, and those supports can look like whatever a person may need. So if I need to chat with somebody at 5 o'clock because I feel that I need some support, something happened during the day, as we all may need some of our friends or colleagues to chat with, that is part of the individualized long-term supports. As well as perhaps on the job training or discussion with the employer. Piece about the integrated with the mental health treatment team is very important. That includes working with prescribers, working with case managers, working with clinicians, that we're all on the same page and we're all helping the person reach her or his hopes and dreams, that we're not saying different things. We're not discouraging people. That person chooses to go to work or promote her education, that's what we are all in it together to kind of. Expectation is benefits counseling is provided from a certified benefits counselor, that we don't give people misinformation about their benefits. We want someone who has access to the Social Security portal, who really understands benefits, and it's not just Social Security, disability, and Social Security insurance kind of benefits. It's really looking at a person's entire financial picture and helping them understand kind of the map, their career path that they want to focus on. So again, I want to bring up our evidence-based practice, the zero exclusion piece. I bring it in because if someone is experiencing symptoms, this does not mean that we're going to wait and not provide employment. This is that we're real serious about, and we bring it up often because as members of the clinical team and other members of the team, it's very, very important for everyone to understand that piece. Again, rapid job search is also important. People don't want to sit around and fill out a lot of forms and have a lot of conversation. They really want to understand what is out there, what's the current labor market, what does it look like, and how do I access those opportunities. Job placement, when we say competitive employment, again, those are jobs that are open to everyone and pay competitive wages. They are not segregated opportunities. Our expectations of employment specialists are to ongoing develop strong relationships with area employers so that we know what they're looking for and we understand what kinds of things we can negotiate and how we can help people secure those positions. This model is not the only thing that we do in supported employment, but it is a roadmap for us. And it demonstrates a great effectiveness in terms of supported employment. If we didn't have a roadmap and the methodology to follow, I don't think we would have the outcomes that we have, because it really provides the employment providers with some of the expectations, and it drives us to really, really get to work and help a person connect with that business or that employment opportunity. And again, rapid job search is the expectation, and zero exclusion. Next slide, Mark. Thank you. Our employment providers provide really a plethora of employment services, and it can be through vocational training. It's assisting people with obtaining job interviews, understanding how to navigate that, perhaps not going to a job interview and getting, securing employment another way. The job development piece, teaching people how to job develop for themselves and also assisting in that process. placement assistance, employment counseling, on-the-job training, talking with employers about reasonable accommodations and what supports the person may verbalize that he or she needs. And then probably the most important thing is to help people provide encouragement and provide that, yes, you can if this is something that you want to do. I mentioned before that our employment specialists are embedded with our clinical teams and the case managers and the prescribers. Truly, employment is everyone's business. This is how it got started when I was starting in the system, that it really was a tagline, and it was really believed that employment's everyone's business, and everyone really needs to understand that if someone wants to access employment opportunities or education opportunities, we need to support that as part of their hopes and dreams. So we all need to work together to encourage people, even when perhaps they're not feeling that well that particular day. We wouldn't be as successful without our Connecticut partners. We work very closely with Aging and Disability Services, the Bureau of Rehab Services. My position is a shared position. We work very closely with the Department of Labor and the American Job Centers, Department of Developmental Services, the Board of Education Services, and our community partners, because everyone provides a different kind of service or resource. So we want to know what those are. And we're lucky that Connecticut is so small, because you can literally drive from one part of the state to the other in a day. I'm going to turn it over to Kathy to speak to the public vocational rehabilitation.
Great, thank you. Good afternoon, everybody. Thanks for joining us. Let me just start by explaining what the Public Vocational Rehabilitation Program is. We exist in every state and territory in the United States. We have been around exactly 100 years as of this year. It's our big anniversary celebration. In some of your states, we may be called ORS, DVR, Rehab Services. Every state has slightly different names, but we exist everywhere. And this basic eligibility criteria that you see on this slide is the same in every state. Person has to have a disability, any kind of medically documented disability. If they don't have documentation, it is our responsibility to get it, to do testing, whatever's necessary. Their disability has to have affected employment for them. It has to have presented a barrier for them. And they have to require services from us to be able to obtain a job, maintain the job they're in, or advance in employment. By far, most states, we do not have any means test, so it doesn't matter if a person has money or doesn't have money. Very few states have a means test requirement, so you bear that in mind. Overall, our program overarching principles are we focus on competitive integrated employment. So we don't do group employment, we don't do sub-minimum wage employment, we do just competitive jobs in the community. Our frontline staff are vocational rehabilitation counselors who specialize in career counseling specifically for individuals who have disabilities. We assess the need for whether they will need a lot of support on the job, a little support on the job, no support on the job. Obviously, it varies tremendously from person to person. And in most states, we contract out the frontline work, the on-the-job site work, the job coaching or the placement to private agencies. And some we have people who do some of that ourselves. And it's important to know that someone does not have to be out of work to come to the vocational rehabilitation program. We are all about keeping people in jobs. It's much easier to keep a job or look for a job, a new job if you already have one, than to be unemployed and trying to find a new job. So if you're working with someone who is struggling in their job because of their disability, the vocational rehabilitation program will be a place to look for some resources. In addition, if someone is in a job where they have not been able to advance as a result of the barriers their disability is presenting, our programs around the country can help people to get to that next level in their career. Next slide. This is just a list of some of the services we provide. The public VR program can provide a almost unlimited range of services, but with a very narrow goal. Our goal is to help people get into, keep, or advance in competitive employment. So we can help people find the work, try out different kinds of work, get training they need to, get the equipment they may need to, anything that they need to be able to get, keep, or advance in employment is what we can do. So here, again, here's just a short list of some of the things we do. The ways we partner with the IPS model with DMHAS in Connecticut is often the kinds of services you see on the screen here. We partner with the employment specialists. In Connecticut, again, a small state, we only have about 60 frontline vocational rehab counselors. Some of the states you folks are from have that many people in a region, so it is a little different here. But we have, in each of our regions, we have a counselor who is the liaison to the mental health system and works really closely with Ellen and with the employment specialist to sort of break down the silos between the public systems. I could give an example. One of the things we do in Connecticut is something called industry-specific training and placement. And that is that we have relationships with companies where we have built training programs in partnership with them, where we will subsidize the training for our consumers who learn specific roles in the company, and then they are hired there. Doesn't sound very fancy, and it's not, but we do have a pretty high success rate with it, and in a wide range of industries in Connecticut. So obviously one of those industries is insurance, but it's also retail and you name it, all different sorts of work. When we get to the end of the slides, if you have questions specifically about BRS or about the voc rehab, I'll be happy to take those questions. Ellen?
Thanks, Kathy. So back in, as Kathy alluded, I'm very, very lucky. The vocational rehab counselors that are our DMHAS liaisons, all wonderful people. I work very closely with them. Part of my job I absolutely adore. Back in 2014, we had been doing these best practices for a very long time, but we established protocol in writing and had both of the commissioners sign off on this protocol, which we turned into a training. And so this is training and guidance for both departments. And I do this on a quarterly basis. I used to drive around the state and go into different regions and do this. Now with COVID, we're just all in front of the screen like we are today. But the good news about that is it really gives us the opportunity to have conversations about what's working and what's not working, and also the interpretation of best practices. So it gives the rehab counselors an understanding of our system. It gives the employment specialists a better understanding of the voc rehab system and how we can complement each other and work together. Which is really essential, and that ongoing communication is really essential. Next slide, please. So our agencies also share training opportunities. My position is shared, and essentially, again, the DMHAS BRS liaison counselors are somewhat shared in terms of our work. They utilize my position for, kind of consultation when we have cases, and we bring both sides of the house together, working together, and it's a really effective way of doing business. So we have some things that we go over on a regular basis. We have expectations that people are having discussions on a regular basis. It may be once a month, every other month. It depends on the region, how long they've been working together. That doesn't preclude them talking to each other left and right in between during the week. It's an ongoing commitment to really discuss what's going on, what's new in each agency, share updates, talk about individual people or individual cases that might be presenting an issue, talk about issues that might be systemic, because that's typically what they are. It's usually not a person kind of thing. And to identify potential referrals. We have our employment specialists talk to the VR counselors about maybe what they've done with a person, what their efforts have been, and then use the counselor as a consultant also in terms of next steps and how we can benefit from other services. So the team protocols really identify roles and responsibility of each team member, including the person that's involved. It's a consumer plan, but we identify all resources from other agencies, community resources. It's not just the, again, it's really what do I need? Do I need help with childcare? Do I need help with transportation? Do I need help with on-the-job support? Who's going to provide that? What does that look like? Is there something in the Department of Labor? Are they doing certified resume writing? Is that something that I can benefit from? So it's really about the team looking at the whole person holistically and figuring out what's going to be beneficial and helpful to that person. So everyone gets to know the person again and what he or she may benefit from. But really, as you know, being in the field, what's the most important thing? The most important thing is to really listen to that person's hopes and dreams and to that place, or get to a place that looks like that place. I talk about my dream job all the time. As much as I love that job, you know, there are other things in my life I also adore. So that's something to really, really keep in our mind. So again, you know, we look at work and choices and hope. And I'm going to talk a little bit about hope in this presentation, as well as just some of the logistics that we do. So from our friends at the Institute, the IPS Employment Center, you know, recovery is not a step-by-step process. You know, we all are looking at continuous learning. We learn from our experiences, some of them not good ones, some of them good ones. And, you know, we become aware of what is positive in our life and maybe what's not positive. And that's how we move forward for all of us. So does this sound different? You know, does this sound familiar to people? You know, I often want folks to reflect about the time where you've needed support, the time when someone believed in you. I think about before I got this position, I was hiking in the woods and one of my friends called me and said, "Oh my God, Ellen, you'd be perfect at this position." Those two sentences were so important and stayed with me for such a long time. And being reminded that you can do it, whatever it is just so important. And I think that's something that in employment, I've recognized over the last 35 years. And I've watched people's lives really change. I've been privileged enough to work with that people, get excited every day when somebody's life changes for the better. So Gary Bond at the IPS Employment Center has captured, you know, why focus on work. I often use this information to talk to clinicians in the field, managers in the field that are all also helping people and helping us do the work that we need to do. You know, many people want to go to work. You know, many people see it as a big part of recovery. It's a basic human need. I'm sure you've all heard when you go to a party or you go somewhere, people say, "Hi, I'm Ellen," and then they ask you, "What do you do?" It's a typical role. It's a typical valued role for people. It can be a way out of poverty. It can also prevent people from even entering the disability system, from going on Social Security disability. And work contributes to better health and well-being. You know, typically if you have a reason to get up in the morning, you're going to get up in the morning. If you perhaps you may stay in bed. So this is a slide that I really like from the IPS Employment Center, because think about it. Life has enough meaning now that I have a psychiatrist, medicine, and a case manager. Why would I mess that up? I used to frequently say to people, you know, are we teaching people just to be good mental health patients? I mean, really, why are we here? We're here really, again, to talk to people about where they see their life going. Not just to group therapy for the day or something else. And I'm not saying that that's not important work and people don't benefit from it, but that's not life. So the impact of competitive employment, and I've seen this with many, many people, people's self-esteem has just tremendously increased. People feel valued, they're in a valued role. They may have less psychiatric symptoms. I worked with a woman who really, when she was alone in her apartment, really enjoyed hearing voices, because she told me that she felt very, very lonely. But yet, this is also a person that really, really likes to go to work, and at times would be working 2 jobs, and would report to me that she had really better control of her voices when she was working. And much happier. She herself was much happier. So this is just, this was a recent capture email of some of the work that across the country and we've been doing in terms of the IPS world. And, you know, the average competitive employment rate is of the folks that we are working with, which is a great percentage. And these are just some of the numbers of people that we've provided services to. And sometimes people need a little bit of help, and sometimes people need more help. So I want to talk a little bit about hope and some individual stories and just share those with you. So back in the day, I keep saying I'm going to write a book, and maybe one day I will. We used to do these community presentations to groups of business leaders and HR folks, and a woman that I used to work with would attend them with me, and she did most of the talking, which was much better because she was much more interesting. And she told the story that she would try to ditch me often when she wasn't really in the mood to work with me. And that I was a bad penny, that I kept showing up and I kept calling and I just wouldn't give up. And on the days that she felt better, she tried several jobs and actually learned several things about herself through those jobs. And I have to say that she truly, truly brought like a light to every place that she worked in. She's just a wonderful, personable person. Eventually, she got a job as a support specialist for the state of Connecticut. And again, so many of the people that we work with have benefited from her story and also just her personality, if you will. But again, it was that never give up on a person kind of thing, which is really people. Next slide. So this is a person who had a criminal history and often became very upset with me when we were looking for work, and said some not so nice things. Slammed the door in the car a few times, said a lot of not so nice things, but inevitably we continued to just keep the path and looking. And she secured a driving position, which she called her dream job. That was her dream job. And her clinician to this day that she's just a person who's much happier when she's working, not a happy person when she's not working. So for her, this is a very important piece. And work that we do is really not about us. It's really about the person. So again, did I feel really good when the door slammed and got called some names? Not really, but you know, it's okay. That's part of the job, I guess. So the next person had a criminal history and was labeled as having schizophrenia and also lived in a tough neighborhood. And I'll tell you why I'm mentioning that. So securing a position with Mike took some time, but it was like one manager who was willing to give him a chance. And in my perspective, and the other folks that were assisting Mike on the job, learning the job, it was really a transformation of his personality. He had a different nickname on at work. He just was so bubbly and so happy. It was truly a valued role. And the reason I talk about the tough neighborhood is because it was attached to a hotel, and we had a really bad snowstorm in Connecticut, and they asked him to stay for a couple of days there. And it was just such a different experience for him to be in a hotel room, get food service. You know, I was giggling just saying to him, so did you just lay on the bed and like click the remote and just order whatever you wanted? And that was like his first experience doing that, because he lived in a very different kind of place. So for him, it was such a positive, valued role, and also really a positive time for him. So it really, truly made all the difference, that particular job for him. So these are just like a few examples of the difference it's made in people's lives in terms of, and again, I could go on and on about different stories of people that I've worked with. But the most important thing that I've thought about and tried to teach people throughout my career is, you know, it's so good when we get to say goodbye to people when someone doesn't need us any longer or need any services and they're on their own and they just, you know, that is in this business, is really for us to say goodbye. So people do get better, people move on, people improve their quality of life, they say goodbye to us. That's great. Sometimes they call us back if they want to, you know, I talk about career enhancement all the time as well. I remind staff that that's part of our job. The only person that I know that has stayed in his profession for 60 plus years was my father. And back then, that's what people did. But for most of us, we move on, we do different things in our life, and we say goodbye to people. I want to share a short video with you also before we do questions and answers. It's a very short video, it's about 2 minutes. And this is a person that one of our providers was working with.
Okay, give me just 1 second to put the video. Yeah.
bipolar disorder. Before I started working, it would be periods of cycling, feeling really good and trying to channel that into something productive before it leaves me. And then there are just complete states of apathy, or I can't do anything, or days where I'm just so tired or I can't get out of bed. Finding work was always a priority. I want to feel useful. I want to be out in the world. I want to be financially independent. I want to be independent in general, and to do that you need money. People are ignorant about the ways that things are for people with mental disorders, that, you know, it's not laziness, that it's not some kind of innate problem with your morals or something, that you somehow brought this onto yourself and you aren't trying. They'll work harder for you. They will put in 10 times as much effort because they have something to prove to other people and they have something to prove to themselves. Going back to work forced me to learn how to manage my demons. They're always there. They're always at the back of my mind. There are moments where I have to find a way to pause and recompose myself, or to ground myself when I can't take a break. And doing that where I work now in my present job has really helped me, I think, to realize that I'm strong enough to handle it. Having social contact is precious. I can't complain about my job, even with the workload, because it affords me the money that I need to live, and also human contact, which is so important. It's so important. A lot of the fear, I think, with going into a workplace when you're dealing with mental issues is that you think that you can't handle it. Aside from worrying about your symptoms, you're always afraid of failure. And once you realize that you can do it, that you can, it's not going to be easy, but you can do it, it becomes much easier on you. I know it feels like you've got the world on your shoulders and that it's just too far away a goal to reach, but you can do it. You can do it.
That's another piece of our puzzle in the IPS world as well, is for people to share their stories, because really that's the most effective way to really have people, you know, share their stories and help people along the way.
So thanks so much, Ellen. Thanks, Kathleen. This was wonderful. I always enjoy so much your presentations. Before we go into questions, I'd like to remind everybody that next week we'll have a segue to this seminar, to this webinar, and we will be talking about recovery and employment. It will be myself and Kendall Atterbury. So with this said, I see here in the chat a beautiful poem from Charles. And I want to ask you, Ellen, first question is about retention. You know, we've been having these conversations, and one of the issues that we hear from IPS is how to address retention, people staying in their jobs. If you could talk to us a little bit about that. And for Kathleen is about how do you see in the BRS world the integration of psychiatric illnesses or serious mental illness, psychiatric disabilities with other disabilities? I've heard from colleagues like there's sort of a discomfort of acknowledging serious mental illness as a disability or including, and how do you see addressing this issue as well?
Sure, I can take that. Well, when the vocational rehabilitation law was first passed in the early part of the last century, it was only for people who had physical disabilities, and it changed in the 60s and 70s by law. So our caseloads across the country have far more people who have mental illnesses than physical disabilities. So I'm unaware. I haven't heard the feedback, and I'm not aware of there being a discomfort with recognizing serious mental illness as a disability in our system, because it's the majority of the folks that we serve across the country.
I do want to add, I don't know, Mark, if you were also asking just about, looking at folks holistically again. So there are many of us who have multiple, perhaps, functional limitations or disabilities. So perhaps I have some mental health conditions, but I also have some medical conditions and so on and so forth. I don't know if you were really alluding to that piece.
I can certainly touch on that. Yes, many individuals we serve have more than one disabling condition that is a barrier to work. That's kind of the human experience to my way of thinking. So I would say the places we struggle with it the most, and I'm generalizing, of course, are when someone has sustained a very serious injury, let's say in a car accident, and let's say it's a young person who is suddenly has had a spinal cord injury and uses a wheelchair, and their life has really turned upside down. And when the person comes to the vocational rehabilitation program, we're going to kind of look at everything. And when sometimes it's readily apparent to a vocational rehabilitation counselor that there may have been mental health issues before the injury, or primarily substance abuse or addiction issues before the injury. That's sometimes a place that comes to light for the first time in the vocational rehabilitation office, because it's probably not something that the individuals who are trying to help the person learn to cope with their new physical limitations are necessarily going to touch on first.
Ellen?
If you want me to address the retention conversations that we've had in the field. So many people that I've worked with are either beginning employment or re-entering employment after a very long time. So it is pretty typical for all of us to experience different things and perhaps not like certain industries or jobs and move on. So I think that part of, like, you as a researcher, and I am not a researcher, part of that is really to look at, where people are in their career path. Is it the beginning, or is it again the beginning? After 15 years of maybe not working, or 10 years or something like that? Is the person a young person who has not experienced many employment opportunities? So that's a piece of that, which I think is very real, and we have to take that into account. As I said, I don't know many people that have stayed in their industry or position for 65 years, except my good old father. Would love me very much that I'm talking about him right now. On the other hand, again, I think we need to talk about career enhancement all the time and obtaining new skills, because if my dream job is something that is not what I'm doing right now, we don't want people to stay in entry-level positions or positions that they just started. We want to look at education and training. We want to look at those things to, again, for people to really earn a living wage, or better than a living wage, than minimum wage, if you will. So that's an ongoing work in progress for all of our partner agencies. And again, one of the wonderful things about working collaboratively with BRS is someone may be in a job and then they need an additional boost in terms of training to enhance their career. That's something that's pretty easy fix in the BRS system, that we re-engage and get some more support and training, and the person is able to access those resources and get a better job or get a promotion or something of that nature.
Yes, thank you. I think I didn't phrase it quite correct. I was more trying to address issues around not knowing quite well what accommodations are when in the mental health, and how we can, because I think that we can, if we have sort of an objective accommodation to address, it might seem a little bit easier to do so. And when accommodations are very individualized and might vary from drastically from one person to another, you know, how the BRS addresses that.
Sure. All our services are individualized. So we don't have, we don't refer people to slots in places. When we reach out to the agencies that we contract with, we'll say, here's Joe, and Joe needs these specific accommodations on the job and is looking for this specific job in this specific community, and so forth. So yes, one of the things obviously that gets talked about all the time in disability circles is how most accommodations don't cost very much. And that couldn't be more true than for individuals who don't need physical accommodations, because often it is something like maybe you need a few more breaks, or maybe you need an adjusted work schedule, or that's the thing that our job developers and employment specialists are, that's kind of their bread and butter, going in and negotiating that. Because most, and maybe being most is overly optimistic, but many employers are amenable to those sorts of accommodations because it doesn't cost them.
Yeah, and while you're speaking, I really like to thank Charles for the beautiful poems he's put in the chat. They're wonderful, and I want to just provoke a little bit, if I may, because what if accommodation is to address discrimination from the employer, or from the staff around mental illness and their misperceptions of what is a psychiatric disability.
Sure. We serve people who have all disabilities, and one of the things that has been probably the most disheartening in my long career is how prevalent discrimination against all disabilities is. It's a very real thing, right? So everybody on this call knows that, obviously. One of the changes when the Workforce Innovation Opportunities Act passed a few years ago, which is the federal act that governs our program, it included specific rules and expectations for our programs to provide training to employers who may or may not necessarily be hiring our folks specifically. We have to go in and provide training and support around disability initiatives, which we love. And one of the things we do in Connecticut routinely, and I can only believe it's the same across the country, is we'll go in and do disability awareness, disability sensitivity, disability etiquette training at companies. And if, when we send in trainers who can make people comfortable, those kind of questions, the more uncomfortable questions, well, what if somebody, whatever. And we're allowed, then it gives us the opportunity to have that conversation and to have an open door where someone can call us and say, well, gosh, I didn't want to say it in front of the group, but I work with a guy, and so the federal law has pushed us in that direction more directly. And I'm not going to argue with you. It is a big barrier. It is out there, but it's being recognized, I believe. And there are many employers who are taking us up on that opportunity.
And I think the other important piece, Mark, about that is our relationship with the employers. The better relationships we have with employers, the more we can have open conversation. And people really are only frightened about things that they don't understand. So really, when you bring information to folks that they want to know about, it is very welcomed, And then you also have lots of HR folks and lots of business, lots of CEO folks who have people in their own families who have their own, needs or our resources that, we're all a part of the same human kind, if you will.
Yeah, that's wonderful. So, does anyone have any other questions that they would like to ask? Yeah, so I will read this last comment from Charles, and we will wrap up. So Charles says, "So very true, Kathleen. Many people who are still working in the former healthcare field in which I work in medical imaging are struggling with long work hours because their immediate peers are ill and or refuse to work due to the current work guidelines. This is nationwide. When the peers complain about their long work hours, many are terminated." Yeah, so there, yeah, please.
I mean, I'm not, I'm sorry, I'm not sure if I understood if there was a question. But I mean, I completely can understand that that would be true and accurate. I'm just, is there a question?
Yeah, because well, it's a comment about we're saying that might be accommodation for people to work few hours, but employers are pressuring. So how to address this issue?
Yeah, yeah. There's been a lot of people scrambling to get their hands wrapped around how COVID fits under the ADA. And I am no expert in that and would not want to comment, but there certainly are experts in that who are out there trying to determine who can request what sorts of accommodations in this COVID world. And those are not easy. I don't think it's been clearly determined. And if it has, I think it changes with some regularity.
So thank you so much again, Kathleen and Ellen. This was wonderful. Thanks. And reminding folks that December 16, next Wednesday at 2 p.m., we will have the Roundtable 2, will be recovery and employment. I hope you all can make it. Thanks again. Thank you for the wonderful presentation, and enjoy the rest of your day.
Thank you.
Bye, everyone.
Thanks.
Thank
Thanks.
you.
Bye.